this patient came to see me a few days ago. And the reason she came to see me a few days ago was because her dentist saw this periradicular radiolucency on her routine x-ray and wanted us to check to see if this root canal needed to be redone. All right, so take a look here. According to the patient, this is tooth number 12. According to the patient, this root canal was done about 9 years ago. 9 years ago, okay? And according to the patient, this tooth has never, ever hurt, bothered her, no problems, no issues. She can chew on the tooth. She has no problems, no issues with, has had no problems, no issues with this tooth whatsoever for the past 9 years. All right. I percussed the tooth within normal limit, palpated within normal limits, probings 2 to 3 millimeters. And of course, you can look at the PA here and you can see a periradicular lucency here. All right. How many of you would immediately recommend endodontic retreatment? Well, not me. So I told the patient, I said, because this root canal was done 9 years ago, and because you've had no problems, no issues whatsoever with this tooth, no symptoms, no sinus tract, no swelling, nothing, zero problems, zero issues with this tooth. Provide us with the name of the your previous dentist so we can get some x-rays. And patient agreed. So we got those x-rays today. So take a look here. So that x-ray is from when I saw her a few days ago. And this x-ray is from a year ago. So this is the x-ray that the dentist sent us. And this x-ray is from about a year ago. Look. So let me zoom out. X-ray that we took a few days ago and x-ray from a year ago. Look. The size of this radiolucency, periradicular lucency, has stayed the same size. The same size. All right? So no need to redo this root canal. There is absolutely no need to redo this root canal. So if I had redone this root canal just because I saw a periradicular lucency there, it would have been unethical, and I would have done this patient wrong. But we didn't, of course, and there's no need at this time to redo this root canal, okay? Now, in contrast, take a look here. Now, this patient I just saw today, just now. And according to this patient, this root canal was done many years ago, like 20-some years ago, okay? And this tooth also has never hurt or bothered the patient. I examined the tooth, percussion, palpation, all within normal limits, probings 2 to 3 millimeters. And you can see here, previous root canal, prefab metal post in the mesial root, this is tooth number 30. And you can see a large periradicular lucency here. So again, because this patient had no symptoms, we requested x-rays from her dentist. And we got them right away. And that's them. This x-ray is from 9 years ago. 9 years ago, okay? So let me zoom out so now you can see the difference. So that x-ray is from 9 years ago, or 8 years ago, 9 years ago, let's say 9 years ago, 9 years ago, okay? And this x-ray is from today. You can see how much larger this periradicular lucency has gotten. So despite the fact that this patient has no symptoms, but because the periradicular lucency 9 years ago was a lot smaller than it is today, this is an active infection. So this root canal will have to be redone, or patient can choose to extract the tooth. So I went over both options with the patient. I showed the patient, put the x-rays next to each other and showed the patient. I said, this is from 9 years ago. You can see how much smaller that dark shadow was compared to the dark shadow today. What do you want to do? You want us to redo the root canal, guarded prognosis, no promise or guarantees, or you want to pull it? Patient said, no, I want to redo the root canal. All right, so take a look here. This patient was referred to me for endodontic treatment on tooth number 31. You can see that there's been a food pocket here, collecting food, microorganisms. Number 31, look at tooth number 30, recurrent decay there too. So, looking at this tooth, this is root decay now. Subgingival decay, take a look here. Number 30, number 31. Like, so much of the tooth is missing. Yeah. Unfortunately, patient will have to take this one out. By the time I clean out all the decay, it'll be subosseous. So, yeah. Okay. Yeah, I was gonna see how old this patient was, but patient was in late 70s, so extraction. This patient was referred to me for endodontic treatment of tooth number 30. Patient's chief complaint is pain to biting. So just looking at the tooth radiographically, starting from up here, so you can see there is bone destruction right here. If you extrapolate from the mesial of the tooth and go here, you can see how much bone destruction this patient has had in the distal of the tooth, and to some degree, of course, on the mesial of the tooth, periapical lucency here and here. So when I examined the tooth, there was a crack, a fracture line on the occlusal surface of the tooth. The entire occlusal surface of the tooth extending on the mesial wall, and on this side extending onto the distal wall. So let's go ahead and look at the video, and you can see what else I found clinically. Okay. This is basically a split tooth. You can see the fracture line here, and covers all the occlusal surface of the tooth. Goes on the mesial wall that way, and then on the distal wall this way. There is a buccal swelling associated with the tooth, and if I go in and take a measurement here, and this falls right in, as you can see right here, to 6-7 millimeters. All right,